We're here with JL, who's 10 years old, who was referred to our office by Dr. Udina. Um, she's doing phenomenally well. She was extremely nearsighted. She was about a -7 with the diopter of astigmatism in the right eye and about the same in the left. And that means that she was able to see till about maybe 10 inches, and anything beyond 10 inches was already blurred. We've completed orthokeratology quite some time ago, and if you look elsewhere on our website, you'll see another video. But now what we've done, in addition to reshaping the front part of her eye with orthokeratology while she sleeps, we've also completed, or she's also completed, a program of myopia management with vision therapy. So the orthokeratology changes the structure, the shape of the front part of the eye, and the vision therapy changes how she focuses at near, because that's the underlying reason why she became so nearsighted at such a young age. Again, she's 10 years old now. Why don't you put into your own words, what changes have you noticed? Oh, and by the way, she wrote a beautiful report about orthokeratology and vision therapy, and we're going to post that onto our website as well. Why don't you share with us, what do you notice? What changes have you noticed?
Well, I noticed that whenever I play tennis in our basement, I notice that I can easily locate where the ball is, and whenever I'm reading, the words don't like split into two, or I don't have headaches or anything whenever I'm doing anything. So I feel much better, and also I'm better and I'm happier, and I'm able to, like, whenever my sister is talking to me, I don't snap at her or get angry.
That's great. I'm sure she appreciates that. What can you tell us about seeing the blackboard or reading your book?
Whenever I'm in school, like whenever I was in the back, now I'm able to see the board much easier, and I don't have to complain to my teacher to move me to the front. I can easily just see the board.
That's phenomenal. What do you tell your friends?
I always tell my friends like how it works, and how like it corrects my eyes when I'm sleeping, or I always tell my friends that, oh, you should go here. And one of my friends, actually, his name is Tejas, he came and he went and got orthokeratology, and now his eyes are fixed too because he used to wear glasses.
Fantastic. Anything else you'd like to share? This is awesome, because this is going to help you not only now when you're in school. You're in 5th grade now?
Yes.
Okay. But you'll find that even throughout high school and driving a car, and when you're in college, you're going to be able to see clearly for far away and for up close. I'm so proud of you and so happy that we've done this. Anything else you'd like to share?
The first time that I started it, when we normally whenever we're driving the car, I actually read books, because I didn't like getting my glasses dirty, and so now I always just like look out the window, look at the scenery, instead of always reading my book.
Cool. Wonderful. Let's turn to Mom. What can you share? What can you tell us?
Well, it's been obviously a very long journey for Jody, but I'm very pleased with the outcome. Before she started Ortho-k, she went from her vision progressively getting worse, and like every time we went for a visit, they would increase her prescription, and a few weeks later she'll tell me that she feel like she's still feeling blurred vision. We'll go back to the physician and they'll increase it. They increase her prescription in a matter of a year. It jumped from what it was, -375 to -700, pretty much. And at that point, she was about to increase it again, and I asked her if there's any other option, because it was only a matter of time before she literally, probably would have to, I'm not sure what the next option was, but when I asked her, she actually suggested that we go and see a specialist, and we came here. I had to tell her the journey, obviously, initially, but when we came in here, I was even skeptical. I wasn't even sure if this would even be corrected without the glasses. So I did some of my own research a little bit, and along with coming in here, a few weeks after she started wearing the lens overnight, she was able to see 20/20, and I couldn't believe it. I had to keep asking her, well, what do you see from this distance? What do you see from that distance? It was consistent. She kept telling me, so I was so shocked until we came back to this office and you told me that her vision is actually 20/20 now.
Okay.
I had to hear it from you, believe it or not, Dr. Rad, for me to believe it. And in the course of that, we also started the vision therapy. You know, her vision has been obviously consistently amazing. Like, she's been really happy with everything. She actually even wants to keep coming back even after all the treatment is done. And so, but I cannot say anything more about, honestly, the whole process. And it's changed her in terms of even the way she interacts with her friends, and even her sister, the way she engages her. It's been awesome. You know, and on top of that, she's actually going to be going to honors next year. She already, you know.
That's awesome.
Yeah, so
That's
she's
awesome.
doing well academically, and she has no more complaints about headaches, dizziness, and everything else. She used to get very tired after reading a little bit, after, you know, doing her homework. She complains, and then she was still, you know, excellent in school, but now she's doing it without complaints in terms of, you know, what she's, you know, experiencing on the outside, you know, of everything else overall academically. You know, so I mean, it's been an awesome experience, and you know, she's happy, and if she's happy, I'm happy too.
That's great.
So.
We're so happy to have helped. Would you like to say anything? No. Okay. Well, thank you so much for sharing, and we're so proud of you. And what we're going to do is we're going to see you back probably in about 2 months or so, just to make sure that you're maintaining the gains, and that you continue to see as well. And I have no doubt that you're going to continue doing well. Thanks so much for sharing.